started quite long back, like 8 years. Of course, it started slowly, but gradually it increased. Beginning, actually, my sister also has done a knee replacement, and I asked her how it feels. Is it better to get it done instead of going through all this pain? So she said yes, it's a good idea. But she has done, and she has relief. But then my daughter looked up into this thing, and she came to know about the stem cell. So that's how I knew about stem cell, and I talked to the doctor about it. Because I didn't know, of course, what stem cell was, and he said yes, it was a good idea, and it could be done on me. Whilst walking, if it's straight walking and fast walking, it's not so bad, but slow walking gives me more pain, and bending the knee is a problem, and climbing the staircase, or putting my foot up and going up, yeah, that's the most painful thing. And of course I can't say my prayers as usual, as I have to bend my knee, which I cannot, so I have to say my prayers on the chair. That's it. And standing a long time, like being a woman, having to cook and longer things to do, that tires me fast, and it hurts a lot.
My cousin told me about it, actually. He said that maybe before trying a knee replacement, which is a little extreme, maybe she should try stem cell therapy, and he said that it's a new procedure, and he actually gave me an example of an athlete who had done it, and they told him that, I think he was a skier, and they told him he wouldn't be able to ski ever again, and he got it done, and he got back, and it saved his career, and he was telling us a lot about it. He was encouraging us about it, so I told my mom about it, and I encouraged her to look into it.
have taken it out from the right side. We gave enough anesthesia there. So that's why we did, in fact, we drilled your bone and sorry. Because we're just injecting the bone marrow.
I said maybe I have to tell you. Otherwise, I can bear it.
How are you feeling? How are you feeling, man, right now? Anything you'd like to say?
How do you feel right
How do you feel right now?
I feel good. Except show to you.
This patient has been with me for the last 6 months. According to her x-rays and her clinical examination, again I would like to make one thing very specific, that x-ray may show whichever grade. I personally believe that I try to synchronize it with the patient's symptoms. So according to me, looking at the x-ray, it is more than grade 3, but symptom-wise, I would put her in the grade 2 to 3. She has pain, but not very so not too much. So I decided that stem cell would be the right thing to do at this stage. I would like to, for the osteoarthritis patient of the knee, I would like to give one suggestion, or my advice is that if you are not in too much of pain, but you can always go for a stem cell injection, which is definitely going to help you relieve your pain, regenerate the cartilage, buy time, and it is a very small procedure, non-invasive, and it gives you a good result within a month's time. It has gained a lot of popularity because of its effectiveness. It is something, as a layman, you can understand, it is something which is taken from your own body and put back into your body itself. No chemical, no any medicine put into it. It's very purely, as you saw, the whole procedure. We just took out the bone marrow, put it in the machine, it separated the stem cell and put it back. Nothing was mixed in it. So there is absolutely no chance of any side effect, or you don't have to worry about it. I would suggest that every person who is having a knee pain should think about it. It has a very good result, and it makes you pain-free